Hello and welcome back to 1 in 75. My name is Alicia and I'm an ovarian cancer survivor, and I wanted to make a series of videos for you or your loved ones or your friends who have recently been diagnosed with cancer. It's nice to have a resource to go to that's not gloom and doom. I'm here to spread hope and joy and just share some of the things that will help you get through this time. If you've got a friend or a family member that's recently been diagnosed, I hope you'll direct them to this channel so I can share some tips with them that will help their journey with cancer and treatment go a little smoother. So today I want to talk to you about a port, or what some will call a power port. Now, you will most likely discuss this either with your primary care doctor or your new oncologist. A port is a wonderful thing that is used for chemotherapy patients to help administer their chemotherapy when they go in for treatment. I'm going to put a picture right up here in the corner to show you what a port looks like, and we'll discuss a little bit about how you get the port implanted, how your medical team will access that port, and just exactly how it works. Now, I have to admit, before I was diagnosed, I had very little knowledge of what a port was. I had a dear friend who had breast cancer, and she had a port. She would wear tank tops, and you would see the port sticking out from her skin. It was very evident. She was not ashamed or embarrassed of it. No need to feel like you need to cover it up. I asked what it was, and she said, "Oh, this is where my chemotherapy is administered." And she told me just very little bit about it, and that just kind of, I don't know, it prepared me for when I had to have that discussion about a port. I was a little bit familiar with it. So if you're tuning into this channel for the first time and you don't know what a port is, or if you've never met anyone with a port and maybe you have this diagnosis and your doctor's starting to talk to you about a port, it's important to know a little bit about it before you go through with that process. So this is the way this was described to me. Imagine that the chemotherapy is a bucket of toxic liquid, which it is. It's in a bucket, and if you had a regular IV in your arm, that IV is going to go into a vein that is like a teeny tiny little brook, a little babbling brook. And that little babbling brook, that pristine little, tender little babbling brook, is going to have an entire bucket of toxins dumped into it. And what is it going to do? It's going to go into shock. A port, on the other hand, is a little device that's placed in your chest. We'll discuss about where that goes in a moment, but that goes down into a main artery, and that's like taking that bucket of toxin now and dumping it in the middle of the ocean. It's going to get dissipated and delivered quickly. It's not going to sit in that tiny little brook and do damage to your veins. It's being dumped out into a big, wide ocean, and you're not going to have the after effects that you would if you had it in your hand. Now, that's not to scare you. If you decide, and if your doctor decide, that having your IVs done every week, if you're an easy stick and you want to do IVs and you don't want to do a port, that is entirely up to you. It is entirely up to you and your doctor and your family. I'm just here to tell you that it was recommended that I have a port. When it was explained to me in that fashion about the little brook and the big wide ocean, it really made sense to me. So we scheduled an appointment. I'm a very hard stick. It is very difficult to get an IV established on me, and that is a wonderful thing about having a power port. Not only are you going to be able to access that port to have your chemotherapy administered, you're also going to be able to access it to do all of your blood work, your blood draws. If you end up in the hospital and you need an IV, they can access it and have all of your medication and your fluids and everything go into that port, so you don't have to have the IVs on your hand. So it is a wonderful thing to have. So putting the picture back up here again, I just want to explain. Your port is most likely going to be triangle in shape. They do have different models, but it's a triangle. You'll see that there are little raised bumps on it, and that's for your technicians to feel where they're going to access it. You'll be able to feel that through your skin. You'll see that there is a long medical tube. That tube will go from the port. Let me move my hair. I have hair. I was bald at one time because my oncologist used to do my hair. So if you can see right here, this is the scar where my port was, right here. that line, that medical line, will go up this part of your chest, and here's my collarbone right here. And you can see I've got a small scar right here. This is to access the jugular vein when they're putting the port in, because that tube will go up and over your collarbone, and then it's going to go into your jugular. It's going to go into this artery, and then it will go down to the artery at your heart, your aorta. So you're going to have one incision here, and you're going to have one incision here, and then all of your medication will be delivered through that port. And again, I've got the picture up here in the corner so you can see what that looks like. Now, this is a very simple procedure to put the port in. I know it may seem scary to you. You've probably already had so much thrown at you, but let me assure you, I'm going to put a picture here and show you just how easy it went. I mean, look at that face. I was having a wonderful time. Again, attitude is key. I had my port placed at the intervention radiology department. It's the same place where you go to get your CAT scans done, to get x-rays done. It's the same place where a lab was for just regular lab work. So my appointment was scheduled to have my port placed there. I went to the back, changed out of my room, was put in a comfortable gown and those really ugly socks. And actually I had to have an IV established in order to get the port, of all things. How ironic. So you will have an IV established. Your nurse will explain everything to you about the procedure. You will probably even meet the radiologist that will be doing the procedure, and he will make sure that you understand everything. They let you know that you're going to have a cut here on this side of your chest, and also that you will have just a teeny little cut here at your jugular. Make sure you follow all protocol before you go in for this procedure. You're probably not going to be able to have any food or liquids after a certain time the night before. Make sure you follow that. Make sure you let them know if you're on any medication and get directions on how to take that medication before you go in for this procedure. Now, I was really surprised when I was taken back for this procedure. It really does look like a full-on operating room. You're placed on a table just like you would be to have an operation done. You have your team. Very, very nice. Make sure you say hello to them, interact with them a little bit. I know it's a scary time. They know it's a scary time. They will do all they can to ease your fears. I think what was hardest for me was there is a drape that is put over your face so that you can't see what they're doing. The drape completely covers, but you have access to the side. You can see out the side. You'll see medical equipment off to the side. So it's not like you're completely covered, but you'll turn your head one direction so they can access this part of your neck. So you're looking out over here. And then the drape comes over and there's a hole so they can just access the area that they're working on. So just know that that's going to happen. If you're a little bit claustrophobic, let them know ahead of time. They'll work you through that. You have your blood pressure being taken throughout the procedure, and mine was actually taken on my ankle. But you know what the best part was before we actually got started, I asked, can we play some music? And they said, absolutely, we can play some music. So we all decided, they said, what do you like to listen to, Alicia? And I said, well, I just love me some classic rock. So they found a Pandora station with classic rock. They cranked it up. That relaxed me so much. If you have a favorite genre of music, see if you can get them to play some music for you that will help you relax, kind of refocus. You're not focusing here and everything that's going on. You're focusing on the music. I highly recommend doing that. I sang the songs, the radiologist was singing, the nurse was singing. We had a wonderful time. It really took all of that pressure and fear right off the table. Now, through your IV, while you're on the table, once you get all settled and they decide that they're going to start, you're going to be given a light sedative. It's just kind of like a little bit of sleepy juice. You're not going to go completely out. It's not even as much as you would have if you were going to have a procedure, say like a colonoscopy. You're not even that out. You're just in a little bit of a twilight. And before you know it, the procedure is going to be 100% done. You're going to be amazed at how quickly it goes. You're really, once they get started, it's only a matter of maybe 10 or 15 minutes at the most. You will feel some tugging, some moving around because they are doing a lot of work right here, but you're not going to feel it. You'll just feel them moving you around a little bit. Now, you may also see some different medical equipment where you're going to see once they put that port in. I actually got to watch when they first administered medicine into the port. They tested it before they sewed me back up, and it was actually up on a screen, and you can see it in your chest, and they will check everything to make sure it works appropriately before they close you up. Now, I was just closed up with 1 or 2 simple stitches and some Dermabond. It's like a super glue for skin. They covered the area completely with some really nice dressing, covered this with just a Band-Aid, and I was sent on my way home. Now keep in mind, this entire area has gone through a lot of trauma. Not just cutting open the area here where they put the port, but also all of this area here has been traumatized because they feed that line under your skin and up over your collarbone. This is all going to be very, very tender. You're not going to feel it because you've been numbed. They numb everything when they're working on you. So not only do you have your little bit of twilight sleepy juice, but they numb the area. So just be prepared and know you're going to feel fine. Everything is wonderful, and you're going to get home in about an hour and you're going to feel it. And I'm not telling you this to scare you. I'm telling you this to prepare you. Make sure you talk to the radiologist, ask what you can take for pain meds, and make sure you take them. Don't wait for the pain to get there and then decide to take something. Stay ahead of it. Just take a little something to take the edge off of this pain that you're going to be feeling. Also, before you have this procedure done, make sure you have some ice packs at the ready. Have some really nice soft ice packs in the freezer ready to go. So when you come home, you can wrap an ice pack in a towel and set it on your chest and just kind of help alleviate that pain. Important note, do not put an ice pack over your port without having it wrapped in a towel. You have metal components in here. You do not want ice on those metal components without having some type of a buffer. Make sure you wrap them in a towel. So once you get home from this procedure, give yourself a couple days. You're going to be tender for a couple days, but it'll start feeling better. I will share with you, I always had a little bit of discomfort at my collarbone. Some people have that, some don't. You're going to have to adjust your sleeping. I always like to sleep on this side, but after having this port put in, I found that I could only sleep on my other side because it just put a little bit too much pressure here. So just know that there are going to be some things that you have to adjust, but you can do it and you'll be just fine. Trust me when I say this port will be your new best friend. Okay, that's all for now for 1 in 75. I'll have some more videos for you later. If you had a port and you want to comment below and share your experience for other viewers, please go ahead and do that. Keep it family friendly, folks. Make sure you don't share a bunch of horror stories. We want to encourage people with positivity. So leave those comments. If you'd like to see something in a future video, comment below and we'll see if we can address that as well. So again, I'm Alicia from 1 in 75. Until I see you again, take care of yourself. Bye-bye.